Welcome to study session 8, Classification and Diagnosis of Clinical Psychology. Introduction. Classification system helps psychologists arrive at a diagnosis for psychological disorders. In this study, you will learn about the various approaches to classification and diagnosis of mental disorders, diagnostic and statistical manual of mental disorders, and the uses of diagnostic system. Learning outcomes. At the end of this study, you should be able to 1. Highlight the various approaches to classification and diagnosis of mental disorders. Discuss the diagnostic and statistical manual of mental disorders. State the uses of a diagnostic system. Approaches to classification and diagnosis of mental disorders. Classification is at the core of any science. It is necessary for the ordering and labeling of objects or experiences to enhance communication among scientists, without which there can be no advancement in knowledge. The term itself is very broad, but basically refers to any effort to construct groups or categories and to assign objects, people, or experiences to the groups based on their shared characteristics. This grouping based on shared attributes is referred to as nomothetic strategy. If the classification is in a scientific context, in the classification of entities for scientific purposes, such as insects or rocks, or if the subject is psychology, it is often referred to as taxonomy. If the taxonomic system is applied to psychological or medical phenomena or other clinical terms, it is called nosology. Nomenclature describes the names or labels of the disorders that make up the nosology, such as anxiety or mood disorders. For a classification system to be useful, it has to be both reliable and valid. For it to be reliable, it has to describe specific subgroups of symptoms that are clearly evident and can be readily identified by experienced clinicians, such that if two clinicians interview the same patient on the same day, all things being equal, they both should be able to make similar diagnoses. If otherwise, then the classification system would appear unreliable and hence subject to bias. A system of nosology is valid if it consistently measures what it is designed to measure. The classification system has construct validity if the signs and symptoms chosen as criteria for the presence of a diagnostic category consistently discriminate the disorder from other categories of disorders. In addition, a valid diagnosis predicts the cause of the disorder and the likely effect of the treatment on another. This is called predictive validity, or sometimes criterion validity, if the outcome is the criterion by which we judge the usefulness of the category. There's also the content validity, which means that the criteria for a diagnosis should reflect how most experts in the field view the diagnosis as opposed to other forms of diagnosis. Different approaches have been used in the classification of medical conditions under mental disorders over the years. They include the classical categorical approach, dimensional approach, prototypical approach, classical categorical approach. Classification can be based on this approach if an object is determined to either be a member of a category or not. The underlying assumption is that there is an important qualitative difference between objects that are members of a category and those that are not. An extreme example of a categorical approach is to classify objects as either living or non-living. This approach emanated from the work of Emil Kraepelin, 1856 to 1926, and the biological tradition in the study of psychopathology. Here it is assumed that every diagnosis has a clear underlying cause, such as viral or bacterial infection, a malfunctioning endocrine system, or any other physiological, psychological, or cultural factor, that each disorder is unique, having unique features that do not overlap with other disorders. This implies that if there are a set of criteria for a particular diagnosis to be made, then all criteria must be present for that diagnosis to be made. And given this condition, the clinician will be able to tell the cause of the disorder. This approach, though quite useful in medicine, is not so effective in the mental health field in determining the cause of psychological disorders. While a trained physician may be able to tell if a patient complaining of a fever accompanied by stomach ache is having an infected appendicitis or just stomach upset based on the close examination of signs and symptoms, and hence determine what treatment will be effective, a clinical psychologist may not be able to so easily determine the cause of depression in the patient. This is because most psychological disorders are caused by an interaction of emotional, social, and biological factors. Dimensional approach. In contrast to the classical categorical approach, a dimensional approach to classification is based on the assumption that objects differ in the context to which they possess certain characteristics or properties. This approach focuses on quantitative differences among objects and reflects the assumption that all objects can be arranged on a continuum to indicate the degree of membership in a category. In this approach, the variety of cognitions, moods, and behaviors presented by the patient are noted and quantified on a scale of, say, 1 to 10. An increasing number on the rating scale indicates the severity of presenting signs and symptoms for the specific condition. Though dimensional approaches have been applied to psychological disorders, most theorists have not been able to come to a consensus on how many dimensions are required. Prototypical approach. The third strategy for organizing and classifying behavioral disorders is a categorical approach that combines some of the features of the classical, pure, categorical, and dimensional approaches. The prototypical approach identifies certain essential characteristics of an entity so it can be classified, while also making allowance for certain non-essential variations that do not necessarily change the classification. In describing a dog, for instance, you can use a general description, the essential categorical features that distinguishes a dog from other four-legged animals like cats, cows, goats, without delving into the specifics of colors, sizes, or species, the non-essential dimensional variations. Thus, this approach to classification of psychological disorder requires that a certain number of the different possible features of the disorder are met out of all the possible features for a diagnosis to be made. Applying the prototype model to psychiatric diagnosis implies that not all people receiving the same diagnosis have exactly the same set of symptoms. Though this system is not perfect, as some symptoms may apply to more than one disorder, it has the advantage of fitting best into our current state of knowledge of psychopathology, and it is relatively user-friendly. Diagnostic and Statistical Manual of Mental Disorders. Clinical psychologists utilize the Diagnostic and Statistical Manual of Mental Disorders, DSM, published by the American Psychiatric Association to determine whether a set of symptoms or behaviors meet the criteria for diagnosis as a psychological disorder. The DSM uses a categorical classification system. The categories are prototypes, and a patient with a close approximation to the prototype is said to have that disorder. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, was released on the 18th of May 2013. There are some changes in the current edition of the DSM when compared to the 4th and earlier editions. While the DSM-4 organized each psychiatric diagnosis into a multi-axial system made up of 5 dimensions relating to different aspects of disorder or disability, DSM-5 has moved to a non-axial documentation of diagnosis. Below is the DSM-4 multi-axial system of diagnosis. Axis 1, clinical disorders and related conditions. Axis 2, personality disorder and mental retardation. Axis 3, general medical conditions related to mental disorders. Axis 4, psychosocial and environmental problems. Axis 5, global assessment of functioning. DSM-5 uses a single axis system that combines the formal axis 1, 2, 3, which separates notations for important psychosocial and contextual factors and disability. Also, certain terminologies used in DSM-4, such as not otherwise specified, used as a catch-all for patients who didn't fit into the more specific categories, has been eliminated in DSM-5 and replaced with not elsewhere classified, which would typically include a list of specifiers as to why the patient's clinical conditions doesn't meet a more specific disorder. The phrase general medical condition is replaced in DSM-5 with another medical condition, where relevant across all disorders. The new DSM-5 has 3 sections and an appendix. Section 1 is titled DSM-5 Basic and Covers, Introduction and Use of Manual. Section 2 is titled Diagnostic Criteria and Codes and covers DSM-5 organization. Section 3 is titled Emerging Measures and Models, covering assessment measures and cultural interviews. The disorders listed in Section 2 of the DSM are neurodevelopmental disorders, schizophrenia spectrum, and other psychotic disorders, bipolar and related disorders, depressive disorders, anxiety disorders, obsessive, compulsive, and related disorders, trauma. Others include stressor-related disorders, dissociative disorders, somatic symptom and related disorders, feeding and eating disorders, sleep-wake disorders, sexual dysfunctions, gender dysphonia, disruptive impulsive control and conduct disorders, substance-related and addictive disorders, neurocognitive disorders, paraphilic disorders, and personality disorders. 18 groups of disorders in all. The uses of a diagnostic system. The classification and diagnostic system is useful in the following ways. 1. Provide a concise description of essential aspects of the patient's condition. 2. Reflect best current scientific knowledge of the psychopathology. 3. Provide a common language for clinicians and researchers to use in discussing mental health conditions. 4. Indicate possible causes of the current condition. 5. Indicate possible future developments in the condition. 6. Provide guidance on possible coexisting problems or conditions that should be evaluated. 7. Provide guidance on treatment options to be considered. 8. Provide a key term that can be used by clinicians to search the scientific literature for more current information on the condition. 9. Provide a framework for determining reimbursement of health services and eligibility for special programs or services. Despite the advantages of diagnosis, there are also possible drawbacks, such as stigmatization of the person receiving the diagnosis and the potential for an inaccurate diagnosis to result in harmful or inappropriate treatment. A reality faced by most healthcare providers, whether practicing in an institutional setting, such as a hospital, or in a private practice setting, is that it is necessary to diagnose a patient to determine whether the patient is eligible for certain services, for example, extra academic support for students with learning disabilities. Furthermore, many managed healthcare companies require a diagnosis before they will agree to reimburse the clinician for services. Summary for study session. In this study session, you have learned that 1. Classification is at the core of any science, and it is necessary for the ordering and labeling of objects or experiences to enhance communication among scientists, without which there will be no advancement in knowledge. 2. An extreme example of a categorical approach is to classify objects as either living or non-living. 3. Though dimensional approaches have been applied to psychological disorders, most theorists have not been able to come to a consensus on how many dimensions are required. 4. Applying the prototype model to psychiatric diagnosis implies that not all people receiving the same diagnosis have exactly the same set of symptoms. 5. Clinical psychologists utilize the Diagnostic and Statistical Manual of Mental Disorders, DSM, published by the American Psychiatric Association to determine whether a set of symptoms or behaviors meet the criteria for diagnosis or a psychological disorder. 6. Diagnostic systems provide guidance on possible coexisting problems or conditions that should be evaluated. We have come to the end of study session 8. Thank you.